So we saw a lot of things in hypertension, really. Things to do with the causes, the different causes, the alcohol. We looked at calorie counting. We appreciated things to do with the glycemic index. We appreciated things to do with the different conditions that could arise if this hypertension is not checked. And we saw also the lifestyle changes that one could do so as to prevent the risk of this. We saw a lot of regulate the hypertension and etc. or the role of potassium and also the fluid balance bit in the proteins. All right, so today let's look at gastrointestinal diseases. We realize that when we are talking of nutrition or malnutrition in whichever case, could be overnutrition, could be undernutrition, we are seeing that the digestive system plays a key role in this. Okay, yeah, because this is where we start with digestion, then we come to the absorption, and also this will help the nutrients get into the bloodstream. So this is the beginning part of the nutrition. Okay, that is why we tend to say that nutrition starts from the mouth, because in the mouth that's where we have the salivary amylase that breaks down the starch. Right. So today, under this engagement, we are going to be looking at the objectives we expect you by the end of the day to be able to explain the pathophysiology and clinical manifestations of the common gastrointestinal diseases. Okay. Yes, and also we are going to be able to identify the nutritional needs and goals for patients with gastrointestinal diseases. Really, friends, you might not always be at par with all the different indications or contraindications of the different foods for all the different conditions that people have out there. But with the knowledge of your knowledge of nutrition and also coupled with the little biology that you studied in the previous weeks, please someone mute. I'm having a lot of backlash this time. That is Clara. Clara, please mute. All right, that's good. Thank you. Okay, so we're saying that really you could not be able to master all the different indications or contraindications for all the different conditions that are out there in the world, but your knowledge of nutrition and also your knowledge of biology and physiology will help you understand which nutrients are supposed to be indicated in which condition. For people from the medical background, you really know that. Though medicine is not try and error, but then you always know where the conversation is driving because you have the beginning part of the conversation, I should say. Hope that makes some sense somewhere. Okay, then also we are saying you need to be able to apply the principles of medical nutrition therapy to design and evaluate appropriate dietary interventions for patients with gastrointestinal diseases. Okay, so the science is always evolving. When we talk of this, we tell you that science is always evolving, and we will be faced with new challenges every now and then. But it is with that understanding of you being able to customize a different diet, of you being able to design a meal plan for something new. People have designed meal plans for astronauts, people who are going to be in space. People have designed meal plans for sea divers, okay, people who are going to be at those low altitudes. People have designed diets for mountain climbers, people who are going to be at very high altitudes. And these different conditions of life, and also basically that could be a lifestyle. But when we talk of health, we understand there are different conditions that will be surfacing every day, things that are not by the book, but things that require your own intuition and understanding and your craft to use your nutrition so that you can make a person get to optimum health. All right. Today we are going to begin with chelosis, and I think you've seen chelosis as shown in this diagram. Though sometimes it might be confused with angular stomatitis or etc. But really, we are saying this is a medical condition characterized by inflammation of the corners of the mouth. Okay, and people usually call it the angular cheilitis. Okay. Yeah, and we are saying this is the common symptoms of this. There is corners at one or both corners of the mouth. Okay, yeah, at the corners of the mouth, people have this. Usually here in Africa, we tend to say that this happen when maybe you're suffering from a disease or you have some fever, and you're saying now the fever is getting out. That is why you get this cheilitis. Though we'll see that it could be attributed to immunosuppression, whereby you're getting all those infections that are coming here and there. But really, this is also one of our gastrointestinal conditions or disorders or diseases, as I should say. So, and we are talking of this gray white thickening at these corners. In most cases, it is gray or white, and also the redness and breakdown of the skin. Right. So what are the common symptoms? Fissures or cracks at the side, this we've seen, and also the golden yellow crusts indicating infection. You know, when a place is infected, it produces, okay, before the scars come, there is that thing that it produces. It is a little golden, it's a little yellow. I would get you a picture maybe sometime, but yeah, I hope you understand what we are talking about, because most people in Africa who tend to suffer from malaria or from those hush fevers still get these fissures. And also, we are talking of a swollen tongue and a burning sensation. So, how does this progress? Okay, all right. So when we talk of its progression, we are talking about how does it become, how does it begin from that very mild step to the moderate, then to the very severe. So lesions are confined at the orophymus and spread over the vermilion border, and then the fissures extend to the facial skin, eczema spreading to the chin or the cheeks, and also formation of prurient discharge and granulation tissues in chronic cases. And if this is not worked on, then we'll get also other complications that could arise. And we tend to say one comes after the other. Either you will get this before you get that high fever, or those other conditions really leading to you becoming malnourished and etc. Because since you will be having all this, you won't be opening your mouth very wide, the chewing will be a little painful. You might also ingest pus if at all it's coming to a person who is not well hygienically and their personal hygiene is in question. Okay, so what are the causes of the and the risk factors? Here we are looking at the nutritional deficiencies. Like I told you, when we come to nutrition or when we come to science or health, there is not only one factor that is uh, beyond doubt the exact cause. Okay, there are different causes, and even in places where we have bacteria or viruses, still there is leeway for you to say, okay, now, but this disease could be having a co-founder, or this disease could be having a mediator. Okay, another thing that will lead us to that particular disease or something of interest, I should say. So when we look at this disease, we are not only confining it to nutrition, but we are saying what could be the nutrition deficiencies that are in there that are leading this disease to thrive. So we are saying nutritional deficiencies, these micronutrient deficiencies such as the iron, the benign, then the zinc, and also these are riboflavin and niacin. These B group vitamins lead to this, and also that's why now we are talking of also infection could be from the Staphylococcus aureus. This could be a bacterial infection, but still we are also not ruling out that nutrition deficiency that could be there. Uh, so what are the risk factors? What are the things that would predispose you to you getting chelosis or cheilitis, as some people would call it? We are talking of poor oral hygiene, people who take long to brush. Okay, yeah. So this could lead to chelosis. We are talking of immunosuppression. Immunosuppression comes with in those people who have other diseases that are suppressing their immune system. People with TB, people who have HIV that is not treated, that who are not getting medication, people who are suffering with the cancers and all those other chronic diseases could have this cheilitis. And also the malnutrition. When we talk of malnutrition, I hope we understand where there is undernutrition, then we actually think of having micronutrient deficiencies therein. So really we tend to think that when someone is underweight, then also they're not getting enough micronutrients into their body. Also, diabetes could lead this, and also denture use. Dentures are these ones. This I think it is a lady. According to the look of the nails, this looks like a lady. Yeah, this lady is holding here. These are the dentures. Or people, you could call them artificial teeth and gums and what. Really, people tend to mix what braces are and dentures. When we talk of braces, braces are those metals that people put in to realign their teeth and everything. People who have protruding teeth, they want them to go a little bit back, then they will put in those braces. But then these are the dentures. Also, the braces can be put for the people who are going to, actually, those are called mouth guards instead. People who are going to fight in the ring, those boxers, the people who are playing those vigorous sports, the people who are playing basketball, rugby, and American football, and all those other things that would require dental protection. Okay, so these are the dentures. Once wrongly placed, they are going to widen your these sides of your mouth orays, and once you widen, they will start tearing a bit, and then the chelosis will begin, causing the wounds, and the wounds will lead to the inflammations and also leading to infection after. So diagnosis and treatment. Treatment, we are looking at clinical examination and culture test for bacterial infection. You know, when we take these samples and put them in mediums and those media and they thrive, then we can ascertain that, okay, that bacteria is present. Um, for the clinical examination, this is what I told you when we're doing our nutrition assessment, that however much we would really rely on dietary assessment and the anthropometry, where we are talking of the heights, the weights, the BMIs, the weight circumference, the skin fold thickness, the demispans, and etc. We here look at a person because there is no anthropometric measure that you're going to use when you're assessing for these. Okay, yeah, you're not going to use a MWAC to assess this. Come on. So uh, we are looking at you being able to understand and examine these clinical signs and symptoms. So the treatment, we are looking at antifungal or bacterial creams. Okay, I think this is where also we tend to give antibiotics for children who are malnourished. And these are the same reasons that when someone is malnourished, we tend to believe that these opportunistic infections or bacterial infections are present even if they are not visible. Okay, yeah. So we tend to give these antibiotics for children who are malnourished. And also, we are talking of topical steroids for inflammation, and then the nutritional supplements for the deficiencies. If the deficiencies are for the B group vitamins, then we will prescribe those. We will indicate those foods or those supplements that are rich in that, and also improvement in oral hygiene. When we talk of nutrition or we talk of health, this is a holistic approach. Okay, you can't talk of nutrition then leave out the wash part of it. You can't talk of wash then leave out the FSL of food security. So we tend to give these antibiotics for children who are malnourished. It's part of it. You can't talk of that. Thing works hand in hand for the overall health of the individual. What are your or you could bite, or there could be the braces, then the thermal trauma. You know, most of us who have taken hot porridge during our primary class next, but then you need to take that hot tea very fast so that you rush to school. It could cause this, and also the chemical irritation from some foods. Particularly, we could talk of this, but then we could also talk of the ulcers and all those things. Not ulcers, let's talk of allergies. Okay, some people have allergies, and these will develop. Personally, I have allergies for red pepper. I don't know them. So anytime I take them, I'll get those sores, like it or not. We have chemical irritation, such as the tobaccos and also certain foods, and infections such as gum disease and other viral infections can cause this stomatitis. When you talk of autoimmune diseases like the lupus and the Crohn's disease, you know what autoimmune means. Autoimmune means simply the body has failed to recognize itself, and it is trying to fight against itself, leading to that. So, how do we manage this stomatitis? Pain relief with the topical anesthetics. Okay, anesthetics are those pain relievers that you could use. These could come in form of tablets, etc., or you could take in these painkillers and all those things. Actually, it is women these days that are more into these anesthetics and also the pain relief medicines, because really women don't want to experience those cramps during the menstruation period. And I don't blame them, because I don't know how cramps pain and all those things, but really, yeah, women are giving that market a little bit of more money. Then also the antiviral medications for the cold sores, and also steroids for the inflammation, and also addressing the underlying causes. And these underlying causes cannot be known, because even when a patient or a client comes to you, they won't agree to this. Even if they are having yellow teeth and the teeth are now no longer yellow but they are becoming golden, still they won't agree that they are having issues. But try as much as possible to talk them out to this. And also, I think you have a course on counseling, okay? Or you have it embedded somewhere in another course. Try as much as possible to be a human being, because you're a human being at the end of the day. Don't crucify clients. When a client comes to you, they're coming for help. Don't become the slaughter chamber also. Yeah, a person comes to you, they're having a challenge. They're having, but you're first touching your nose because they have a smelling mouth. Okay. First, let them express themselves. Actually, you might even not talk of their smelling mouth the first time they come to you. Okay. Then talk about it the next time they come to you, or even on a third visit. Things people are not comfortable with these things, some of them. Okay. Or you just prescribe them. How many times do you brush? That is one. You use those other tones and all those other statements that don't make someone feel as if they are being crucified. You can ask them how many times do they brush. And when they tell you once, you can tell them, okay, now try 3 times. Well knowing that now the person will make an attempt and brush at least once a day, and use that psychology to help you and also your clients live a better life and improve their lives. Okay, prevention, maintain good oral hygiene, then avoid irritants and allergens. Allergens, these are particles that will bring allergic responses to the body. In most cases, people have allergies to different things. I think this is where the statement of the taboos came in, the food taboos that we have here in Africa. But really, some people even have allergies for pollen. Like they don't want to be near flowers or near near those flowering plants, because that pollen will bring them problems. Always stay hydrated and well nourished. And also, we are talking of address the underlying health conditions promptly. You could also even ask that how long do you take when you're eating food? And you realize this individual is just rushing through the food. Then you ask what type of food you eat, and you realize this individual is eating cassava and only plain cassava with even now without water also. Yet remember, you need the water at least to soften this food. But this person thinks they trust their saliva a lot, and they are eating cassava every now and then, and they are causing those sores at the upper end of the mouth. So let's look at the gingivitis or gingivitis, any way we would choose to pronounce that. And we are saying this is a common and mild form of gum disease characterized by inflammation of the gingiva. Okay, yeah. As you will see, we are looking at what are the causes. Mostly, this one, its most common cause is uh, poor hygiene. When we talk of gingivitis, we are looking at these foods, okay? The foods seep into the gum. And remember, the more the person doesn't brush, then this plaque accumulates inside the gum in here. And a lot of people have them. You will end up seeing a person that has accumulated a lot of this calculus. And also now there is inflammation starting to build up. Some people have they are now very solid. Okay, the plaque is very solid. It's now even black. Other people even require to go to the hospitals to get that thing removed. But it is okay. We are not saying that you're going to crucify a patient who has this. Okay, the mere fact that they are coming to you is actually good enough because they realize they do have a problem and they can't solve it alone. So you first thank the person for coming to you if they have a challenge, and then start addressing the other things, and you will see things going on smoothly wherever you are. So we are saying this can progress to periodontitis and lead to tooth loss if left untreated. So remember, this will start altering the nerves and all those root canals. I'm not a dentist, but I know a little about those things. So once that all that starts, then you will get problems. And at the end of the day, the person will say, to hell with the tooth, let me take it out. And also maybe something that we've not talked of here, we'll see that this also sometimes leads to sensitivity of the teeth. You know that part when you take in cold things, your teeth can't stand them. Then even when you take cold things, your teeth can't stand them. Even a mere inhaling of the air, when it goes to that part of the tooth, you feel like you want to die or something like that. Yeah, a lot of this, and a lot of people are having challenges. That is why the dentists are making a lot of money in those developed countries. You know what? The developed countries, they are not refusing their children from eating those sweets and all. You know how we had a lecturer who will tell us of a storybook that they read to those children in those developed countries of Bactus and Carius and Bactus, something like that. You can go and Google the story, but they were talking of the bacteria that comes in the night and eats the tooth of a child because this child has failed to brush before they go to sleep. Well, in our developing countries, you could say people are talking of, okay, the toothpaste is a little expensive, what, but at least try as much as possible to use that, to rinse your mouth even before you sleep. If the toothpaste is not there, at least then use the brush without the toothpaste, then use the toothpaste in the morning as a measure first. But if you feel you can afford all these things, and even the toothpaste is not expensive, but always put yourselves in the shoes of people who don't have a lot to offer. So what can you do? Are you going to let them die at the end of the day, or you're going to let their lives become miserable with these tooth decay and all those other different conditions? All right. So what are the symptoms of this gingivitis? We are looking at the swelling, the puffy gums, the dusky red or dark red gums, and also the bleeding gums when brushing or flossing. Flossing is when you're removing those particles that remain in the teeth. Really, people tend to say it is good to floss three times a week, 4 times a week. I'm not so sure about that. If we have a dentist, they will engage us later on in the in this class. When we are talking of this bleeding gums, you realize it is a challenge. Okay, and also the flossing is a little bit of a challenge. People floss with any object they find, with khakis, with toothpicks, with whatever they come across, with sticks. So at the end of the day, sometimes you end up injuring the gum. And when you injure the gum, the blood will come out. And the blood is full of nutrients. What do you expect if a person is not having good oral hygiene? The bacteria will come. And once the bacteria comes, the deal is done. We have receding gums. Receding gums are those gums that are now going further, exposing the tooth. Okay, instead of them being a little firm, they are going down further, exposing the tooth. And also tender gums, you see them so red and swollen, and even when you press on them, sometimes when people press on their gums, they can see that white liquid. Should we call it a liquid? Or that white stuff that comes out, which could be looking like pus, I should say. So prevention and management of this gingivitis, we are looking at good oral and health habits, brushing twice daily, flossing daily, regular dental checkups. I don't know, maybe we would task ourselves and ask when was the last time we went for dental checkup. Maybe unless for the people who are in a medical setting or in a medical center, but really even us. Who have a little medical insurance, still we find that okay, now going for medical checkup, okay, really, but it is something that we need to be doing. You know, it is in Africa that we'll first wait for the problem to happen, then we go for the for the solution. Okay, before a tooth pains me, I really don't see a reason why I need to go to the dentist and give them my money, or you see it as time wasting until you get a tooth pain or your teeth become sensitive, or unless you're a model and you want to shape the size of your tooth and put in the braces and etc. Yeah, and with the management, we have looked at professional dental cleaning. These people have those procedures they do and remove that plaque that is accumulating in the teeth. But some people have argued, and quote me well, I'm not saying anything, that the more you go for these dental cleansing and all those things, the more you're making your teeth weak. I don't know how true this is, but they say the more you go for these things, the tooth whitening and what, you're making your teeth more weak. Okay, and also there is an issue of the calcium, something like that. So you will do some reading. But me, what I encourage is good oral hygiene. I'm not so sure about the contraindications that could be there or the disadvantages of you going for this professional dental cleaning, but we are for it for the people who have accumulated a lot of plaque in there. And also the antimicrobial mouthwash for people who are having these challenges. You could use here. We have an antimicrobial mouthwash, though it is, I think it is duplicate. I don't know. I'm not so sure about it, but yeah, it is. Or either they duplicated the brand. It was called Nana mouthwash. I don't know whether you have it that side, but Nana mouthwash, I earlier on it used to work, but right now it doesn't work. So I don't know whether the original product is the duplicate or we are getting a counterfeit from a different supplier. In Africans, you're very bright. And also we are looking at periodontal therapy if needed. So let's shift and look at mouth sores. You're going to ask me, why are we looking at all these things if we are nutritionists? Like I told you, these things start from the mouth. The digestion starts from the mouth. You being able to break down the food. We looked at gastrointestinal disorders too. Okay, last time when we looked at, really, did we? Oh, we are looking at it in here where we were looking at, but we saw something about the irritable bowel syndrome and all those other things when we were looking at the gastric bypass, the Roxanne bypass, and etc. And when are they supposed to be indicated? So you need to have a whole understanding of a human being. You're going to be tasked to develop diet plans for people with asthma, and you're going to be like, oh, what is asthma? Go and do a little reading, come back, use your knowledge of nutrition, know what is needed, when is it needed, when is it required, and develop something. Right, for mouth sores, we are saying these are painful ulcers found in various areas of the mouth, including the cheeks, the lips, the gums, tongue, and the soft palate. And what are the causes? We are looking at a range of stress to gastrointestinal diseases. Okay, stress is any physical stress or anything that you're putting against them, and also gastrointestinal diseases. So, what are the symptoms? We are looking at burning and tingling sensation, pain, they are followed by painful ulcers. An ulcer is any outlet or a wound in the body. So if someone tells you of the gastric ulcers, then you know that is the place where they are located, and that is where the wound is located. Duodenal ulcers, that is where the ulcer is located. So what are the causes of these mouth sores? One, we are having the candida from the candidiasis, and then we have these bacterial infections such as the Staphylococcus aureus, and also the bad habits such as chronic lip leaking. Okay, people who always want to lick their lips. I don't know how this is a chronic thing, but anyway, I hope we don't have that here. Then thumb licking, this we used to do as children, but then some people fail to outgrow it, and then also chewing on objects. Even in this class, we have people who can't maintain is it called this cover of the pen? You can't maintain the lid of the pen to be there. You need to bite everything that is plastic that is closer to you. You want to bite it. You can't remove without a toothpick. You want to bite on it. You want to chew on something. So really, these are the challenges that you could find. You could get these sores, but also we are not saying this is where it is coming from. We are thinking also that nutritionally this could be due to lack of iron and also the vitamin B group and also zinc deficiencies. So we need to indicate these when we are trying to manage these conditions. Also, for the medical conditions, we are looking at gastrointestinal disorders and then the systemic diseases, and also genetic conditions could lead to these. Medications, recreational drugs, and allergic contact with the dermatitis. So managing these, we are saying choose soft bland foods that are easy to chew and swallow, such as the soups, the stews, the meals, the yogurt, the puddings, the mashed potatoes. Rice is a little bit, grain like. So we do not always advise. But then for ways for soft rice, then we can really advise you to prescribe this for the individual. We realize that when we talk of these could look as soft to you, but then they are making people fail to take in. And when there is reduced intake, we expect reduced absorption. And when there is reduced absorption, then we expect very low nutrients in the body. This is where actually the nil by mouth come in. Okay. When we say nil by mouth or nil by something, we mean nothing goes in by the oral route. Okay. So this is where your enteral feeding will start from. That you will say now if the person is feeling everything, so he can't even take in a soup, or he can't take in a stew, or he can't even use the yogurt or a pudding. Then what do we do? Let's put in an nasogastric tube, let's put in an nasoduodenal tube and etc. So that at least we can deliver these things if this person can't take in what is required in the mouth. Okay, also avoid foods and drinks that irritate the mouth sores, such as the citrus fruits, the juices, the spicy or salt foods, tomatoes, the carbonated or caffeinated drinks, alcohol, and also very hot foods that will upset a human being. You know, patients are very funny. Once you're talking to a patient, you should at least meet halfway. It shouldn't be you always leading the journey in this engagement. It is only in medicine that, okay, without this medication, you're dying the next day. But when it comes to nutrition, really, there are a lot of options here and there. You need to find options. That's what will set you apart. That's what will keep bringing clients to you if you have a number of options. If someone comes to you and you say, okay, stop eating meat, then the person will tell you what will I eat. Then you even don't have anything else. You can't tell them fish. You can't tell them that there is meat from a plant source like the soy meats and what. You can't tell them that you can get this from chicken or what. You see, there are a lot of things that you could play around with because the foods are different. And that's why you see that you only need the concept. And once you get the concept, you can practice this nutrition everywhere. You can actually go to Saudi Arabia where the foods they have are different from the foods that you know here. But once you know their compositions, you can develop a meal plan for a diabetic Arabian who is that side. Okay, then you're also saying drink plenty of fluids or stay hydrated and prevent a dry mouth. Okay, use a straw to drink fluids if it helps to avoid the sores. Okay, instead of when you put a straw, you are at least giving direction to take in the fluids at the very back of the mouth instead of leaving them here in the middle part where they are going to cause a lot of irritation when someone is taking in. And also we are saying Eat foods rich in protein to prevent weight loss. We've over explained this, and also promote healing such as the ground meat, the eggs, cottage cheese, beans, lentils, and smoothies. And also, we are saying eat small frequent meals throughout the day instead of the large ones. And we are saying this may make it easy to tolerate the foods and swallow them rather than eating those large chunks. Gives this person, if you feel meat, just divide the quantities of what the person needs to take for the whole day into different small portions so that the person can take them slowly. And also, we are saying rinse your mouth several times a day with a solution of water and baking soda to remove food particles and there to promote healing. Well, people have argued that garlic has some healing properties for the teeth. And also, we are saying that people who tend to use warm water and salt, okay, for the people who are having teeth challenges, it tends to work. Those are home remedies, I should say, that do not have a lot of scientific proof but are known to be working. They are also saying do not use alcohol-based mouthwashes as these will worsen the sores. So when a tooth is paining or when you're having sores in the mouth, don't apply sanitizer. Use a soft bristle toothbrush to gently brush your teeth and gums and remove the dentures if they cause discomfort and keep them clean. Okay. What is advisable is to first dip these dentures in water before you put them in. I think so. We will get some clarification. And also, we are saying use a soft toothbrush. That is why I'm telling you people that in most cases, we tend to rush the brushing process. People don't know that they brush in a circular motion. People just brush sideways or up and down or whatever. Yet it is supposed to be done in a circular motion. But these days there are even those electric toothbrushes. You know those toothbrushes where you need to put in a battery, then you press and those bristles will just rotate. Okay, then you clean your teeth. So for people who are having challenges with reaching all the corners, really these electric toothbrushes have been known to help promote oral hygiene for people who have the money still. But then also there is also some evidence of people saying that these still weaken the teeth. Okay, so the brushing should be soft, but for a longer period of time. For not a longer period. When I say a longer period, I'm not talking of an hour. Okay, I'm talking of close to 3 5 minutes. But really, we don't even make a minute. Trust me. And also, you be very honest to yourself. If you take a minute or two when you're brushing your teeth, really, we just rush through the whole process. Okay, and also you're saying get prescription of mouthwashes or sprays that can numb the mouth and throat to reduce the pain and also avoid smoking or use of tobacco products as these delay healing and also increase the risk of infection. So we are done with the mouth. At least we've seen something to do with the mouth. Then let's get a little bit down and look at the esophagus. And we're saying this carries foods and liquids from the mouth into the stomach. You know all that bolus thing. What is it? Food going down by gravity and the bolus and the capillary action, the capillary muscle contractions. I'm forgetting something there, but yeah, I hope you remember. One, we have the achalasia or the motility disorder caused characterized by loss of ventricular neurons leading to impaired relaxation of the lower esophageal sphincter. Okay. Yeah, and also we're looking at the gastroesophageal reflux disease, or you could call that or esophagitis, which will lead to the backflow of gastric juices onto the lower esophageal mucosa. So, having looked at the mouth, now we are looking at the esophagus. Okay, it is the other part of our alimentary canal, or what you could call our gastrointestinal system. So we are seeing that there could be challenges even in the swallowing. Remember, if someone is having challenges in the swallowing, that doesn't mean that this person should not cease intake. For things to do with the achalasia, we are seeing that really this could be Though it is rare in our settings, but it happens. So these muscles uh, at the lower end fail to relax, which will cause a little bit of difficulty in swallowing, and also could cause chest pain. It could cause regurgitation. When we talk of regurgitation, is bringing back the food. Okay. Sometimes when you're swallowing, you can feel you're having a difficulty in swallowing. Sometimes it comes as a shock to people when they are swallowing. In most cases, when I don't know whether it's supposed to be a coordination, because this is an involuntary action. Okay, you fail to swallow pretty well, and you feel as if you're choking, but okay, then finally it goes. Yeah. So this sometimes happens, though we are saying it can be diagnosed through those manometry, and also it can be treated in most cases using surgery, and also this will help you relieve the pressure that is on the esophagus. Okay. Yeah. For this, that is really self-explanatory when we talk of the gut. Okay, that is a little bit self-explanatory. Excuse me. For so for the gut, we are saying here we are looking at reflux. Okay, where we are saying now this to make it a I don't know what's happening to me, but we're saying this could be chronic, and when we talk of chronic, that means it is a little long lasting, okay, or a repetitive condition where the stomach acid flows back into the esophagus, causing things you will see later on, things to do with the heartburn, the difficulty in swallowing, and this could also lead to things like the esophagitis. When you hear that word "tis" at the end of any statement I make, "tis" is you could call it it's a prefix suffix. I don't know. Someone in the English would help us there, but it is something to do with inflammation. So wherever you see colitis, ascites, not ascites really, but anything to do with the "tis" at the end, really, it is more to do with inflammation. Causes of this, you could have irritating effect of the acidic gas reflux. Stress could be a factor leading to this, also ingestion of the irritating agents. Then we also have the viral or the fungal infections, aging. This is known to happen, very common to the people who are the elderly that we have in our community. Then we have the radiations, and also different medications lead to this. Symptoms or the signs that you could see, people tend to talk of the heartburn, people tend to talk of the regurgitation, and people really tend to talk of the dysphagia, and also people tend to talk of the bleeding. Uh, when we talk of dysphagia, really this is just a difficulty in swallowing. Okay, so when someone tells you dysphagia, really mean that that is a difficulty in swallowing. This can occur at any point along, that swallowing process from the mouth to the throat, and it can result from things to do with the neurological disorders, and also the muscular disorders, and also other abnormalities that could be. So what could be, how would we manage these esophageal disorders? We are looking at the lifestyle modification. Here we are looking at the dietary changes, the weight management, and also the stress reduction. Once we reduce the stress, we have a lot of chances in reducing these esophageal disorders. And also medications such as the antacids and the proton pump inhibitors, and also the prokinetic agents. Surgical interventions in severe cases when we can't deal a lot with this. So, friends, let's interest ourselves in which foods should we avoid when we're having these, really, the fatty foods, the fried foods, the sour foods, the unripe citrus fruits like the mangoes, the garlic, the ginger. These are a little bit of the foods that have a lot of acids in them, and these acids could bring back the gastric reflux, the acids back into the esophagus, and we'll have those challenges. And also these strongly flavored vegetables, those condiments, people who are using a lot of things. Also, we try to avoid the spices, the condiments, the chilies, the pickles, the strong tea and coffee, and also those alcoholic beverages. Really, we tend to recommend foods that are including that, but not limited to cabbage, other vegetables. Is someone trying to say something? Okay, please mute. Then the other vegetables such as the carrots, the peas, the okra, the green leafy vegetables.
Highlighting a strategy for the peace mediation between South Sudan's government and
Someone
sub-Saharan
is watching something. All right. Then for the fruits, we have the orange juice, the apples, the red bananas, the avocados, the okra, and the cereals too. Alright, still what is recommended, we can see the oils, the beverages, the eggs, the roast beef and lamb, and also those other things in there. Effects of the antacid use. So how when you use this antacid, what happens? This impair the absorption of phosphorus and vitamin A. They destroy thiamine. They interfere with the pepsin enzyme activity, elevated pH over time. And when we talk of elevated pH, that means we are going higher. And the higher we go, that is the more alkaline we go. And also we are looking at the decreased absorption of calcium, iron, magnesium, and also zinc. And also this may lead to anemia at the end of the day, since that happens. Then also dumping syndrome, really, let's interest ourselves with the dumping syndrome. And when we talk of the dumping syndrome, we are saying this is a complication of the gastric surgeries disrupting normal food passage into the duodenum. Okay, yeah. So after someone has got a surgery, this could disrupt the normal food passage into the duodenum. So really, when we talk of this, in most cases, this occurs when food moves too quickly from the stomach into the small intestine. Okay, or also those other parts of the stomach. Remember when we were looking at the gastric bypass, therein we saw that now for people who want to lose weight, they try to shorten the distance from the stomach, and they bypass the stomach and get at the very end of the intestine and in the Roxanne Y. And also for people who have decreased the size of their stomachs, okay, who have made that pouch there. But then even for people who have bypassed, so when the food is passing these places quickly, it can result into the dumping syndrome. So this happens after those surgeries. And also this the symptoms here we are looking at sweating, weakness, rapid pulse, diarrhea, and also abdominal pain. The nutrition implication is loss of nutrients and weight loss, because if we lose nutrients, then we could think of weight loss coming therein. Aims of nutrition management: provide adequate calories for tissue healing and also prevent weight loss. If I'm so fast, you can tell me you're going so fast, but really we are almost closing up on this lecture. Then also correct short-term hypoglycemia. When we talk about hypoglycemia, hypoglycemia is when there are low sugars or low levels of glucose in blood. That is a hypoglycemia. This is because there is not enough time taken for the absorption to happen, because the food is just rushing through the alimentary canal. So withhold fluids and foods for 3 to 5 days and feed via the nasogastric tube. Okay, yeah, so that now we can put in the foods where they need to be a little bit, and also gradual progression to your general diet as tolerated. And also offer bland foods initially, prioritize foods patients like and can tolerate. This is why it is always key when it comes to clinical nutrition and also dietetics at large, that we need as much as possible to try and do what the client wants, although we are not going beyond our ethics. But at least if something does not bring any challenge to our client, please let them have them. Don't take anything by rule of book. For things that can be accepted in a diet of an individual or client, please do as much as possible to allow. So dietary management after surgery: what happens when a surgery has happened? Offer small frequent meals, limit simple carbohydrates, and also lie down after eating to slow down food transit, but avoid clients with a reflux. Reflux is acidic, this thing of coming back. I don't want to call it vomiting or anything like that. And also consider excuse me. And also we are saying lie down after eating to slow down food transit but avoid clients with reflux. And I said, really, reflux is the backward flow of this acid into the esophagus, which can cause those things that we saw earlier on, the heartburn, the chest pains, the difficulty in swallowing, etc. And we are also saying consider vitamin and mineral supplementation if needed. So, friends, let's interest ourselves with the irritable bowel syndrome, and which some people term or abbreviate as the IBS, and this is a functional disorder affecting the large intestine. Okay, yeah, and it is very common, and it is characterized by abdominal pain, the bloating, serpentine, and also changes in the bowel habits. Okay, so things to do with the diarrhea and constipation, or you could even suffer from both. All right, and then the syndrome here, we are saying it's a group of symptoms without causing damage or other diseases. And the risk factors could be age, teen years or early adulthood, and also for the gender, this is more common in females or in women, and also a family history of either irritable bowel syndrome. The causes could be gut infection, food poisoning or surgery, and also bacterial or hormonal neurotransmitter imbalances. Really, things to do also with the antibiotics or medications could lead to this IBS. The symptoms could range from diarrhea, things to do with constipation, mucus in stool, and swollen or bloated abdomen, and a feeling of incomplete bowel movement, and also nausea and heartburn could happen. So, nutritionally, what could we do for a person who comes presenting with the IBS or the irritable bowel syndrome? So, here we aim to restoration of good nutritional status, and also relief of discomfort. First, we need to add fiber gradually to aid in the normal intestinal function, and also avoid those fatty and greasy foods to reduce the cholecytokinin production. And also, and also avoid the gastric irritants like caffeine, alcohol, and nicotine, and also monitor response to specific foods and limit gas producing foods, and also opt for smaller, frequent meals to prevent cramping. Okay. Yeah, so also practice relaxed eating to minimize air swallowing, keep food diary to identify the foods that you can tolerate, and also wear loose clothing and engage in regular exercises to strengthen the abdominal muscles. You know, those are they called sit-ups? Sometimes people do it and they cause problems, but here try as much as possible to strengthen those muscles, and also through manage the stress through various coping mechanisms. Really, inflammation of the bowel, we've seen this, and also now we can talk of the Crohn disease, where this is just when we talk of the Crohn's disease, we are really talking of the inflammation that can happen anywhere from the mouth to the anus, okay? Yeah, from the start of the alimentary canal to its end. And the characteristics, we are looking at the unpredictable flares and remissions. So here we are saying this is a disease that can affect any part of the digestive tract, things to do with the chronic inflammation and potential or serious damage to the digestive tract. And these are the signs and symptoms that you could see: the diarrheas, the weight losses, the fevers, and stricture formation. And also, we could look at what are the causes. The causes could be the causes could be inflammation of the digestive tract, inadequate food intake, and also malabsorption. So, friends, what are the implications? Once you have this Crohn's disease, we will expect to have inadequate food intake, malabsorption, increased nutrient needs, and also restoration of food nutritional. The aim is to restore the good nutritional status of the individual, and also relief of the discomfort, because you know the foods that will really lead to this inflammation are those foods that are high in acid. So we don't want to see you telling someone you can take some lemon You can take those things that have the citric acid in them. So dietary management of the Crohn's disease, we are looking at during acute flare-ups, bowel rest, and parenteral. You remember when we talk of parenteral nutrition, what we mean are recommended. Then elemental oral formula may be useful for patients unable to tolerate whole foods, and then provide high energy, high protein diet for healing and weight restoration. Offer low fiber diets to minimize bowel stimulation, but also since there is a lot of irritation, still don't prescribe a lot of fiber, because still it will really increase the irritation. And also opt for small frequent meals to maximize intake and assess and supplement calcium, magnesium, and zinc as needed. So friends, we have looked at the diseases of the gastrointestinal system, or gastrointestinal diseases from the mouth. We've seen things to do with the esophagus, and really we have also seen the irritable bowel syndrome. However, we can't tell you that these are the only conditions, but these are those that you will see anywhere. Things including the Crohn's disease, but people will come with all types of conditions and cancers and expect you to do something for them nutritionally. Friends, I beg to end here today's engagement unless we have an issue to raise. Uh, if none, then we can call it an evening. Do we have any issues? Yes, you des. I'm seeing. Have you raised a hand?
Not really.
Not really. All right.
Yeah, but I have a question.
Yes, you. Okay. I thought you raised a hand. I saw a hand here. Okay.
I didn't raise, but like I let me ask a question, a
Mm,
concern.
mm.
Yeah. So suppose I come across a question saying, what are the gastrointestinal disorders contributing to malnutrition?
That's.
Should I
Mm.
answer using these gastrointestinal diseases, the one we went
Ye-
through?
yes. And these are
Okay.
not the only ones. Okay.
Yeah. Yeah.
Yeah. Yeah. So you could do that research and go on, but these really are the gastrointestinal diseases, and also you could call them conditions anywhere at the end of the day. All right.
Okay.
Yeah, and
Yeah.
for a take home, we are not doing this to pass. For what I know, everyone will pass. Whoever has attended my classes will pass. But we need this information out there because people don't know it. And this is what is going to set you apart from everyone else. All right?
All right.
Mm.
All right. Thank you.
All right, Tito and Rual and Clara, thank you for attending. I call this. You have a good night. I'm going to have another engagement shortly after this, so you can have a good night. Thank you for attending. Meet you tomorrow.
Okay. Thank you.
All right. Thank you too.
Okay. Okay, good.
All right, good night.
Good night.